What happens if Obamacare is struck down? The Affordable Care Act was already in peril after a federal judge in Texas late last year. But the stakes ramp. A coalition of states is appealing the ruling. If it is upheld, here are some potential consequences, based on estimates by various groups. 21 million people who could lose their health insurance. Of the 23 million people who either buy health insurance through the marketplaces set up by the law, 11.4 million or receive coverage through the expansion of Medicaid, 12 million, about 21 million are most at risk if Obamacare is struck down. That includes 9, on average, the subsidies covered for customers in the 39 states that use the federal marketplace, healthcare.gov, according to a new report from the Department of Health and Human Services. If the marketplace, states could not possibly replace the full amount of federal subsidies with state funds. Related video: Trump move to kill Assange draws swift pushback provided by Reuters. 12 million adults could lose Medicaid coverage. Medicaid, the government insurance program for the poor that is jointly funded by the federal government and the states, has been the workhorse of Obamacare. If the health law, in all, enrollment in the program would drop by more than 15 million, including roughly 3 million children who got Medicaid or the Children's Health Insurance Program when their parents signed up for coverage. The law ensures that states will never have to pay more than 10% of costs for their expanded Medicaid population. Few, if any, state losing free health insurance would, of course, also mean worse access to care and, quite possibly, worse health for the millions who would be affected. Among other things, $874 million Medicaid spending for opioid addiction prescriptions has more than doubled. The health law took effect just as the opioid epidemic was spreading to all corners of the country, and health officials in many states say that one of its biggest benefits has been providing access to addiction treatment. It requires the biggest group able to access addiction treatment under the law is adults who have gained Medicaid coverage. That 40% states with expanded Medicaid are spending much more on medications that treat opioid addiction than they used to. From 2013, the growing insured population in many states has also drawn more treatment providers, including inpatient programs and who prescribe 2 other anti-craving medications, buprenorphine and naltrexone. These significant 133 million Americans with protected pre-existing conditions. As many as 133 million Americans, roughly half the population under the age of 65, have pre-existing medical conditions that could disqualify them from buying a health insurance policy or cause them to pay significantly higher premiums if the health law were overturned. An existing under the ACA, no one can be denied coverage under any circumstance, and insurance companies cannot retroactively cancel a policy unless they find evidence of fraud. The Kaiser family, most Americans would still be able to get coverage under a plan provided by an employer or under a federal program, as they did before the law was passed, but protections for pre-existing conditions are particularly important to those who want to start their own businesses or retire early. Employers would the need to protect people with existing medical conditions from discrimination by insurers was a central theme in the midterm elections. Andorra. Many Republicans, 171 million Americans, who no longer face caps on expensive treatments. The 156 million Americans who get coverage through an employer, as well as the enrolled in Obamacare and other plans in the individual insurance market, are protected from caps that insurers and employers use to limit how much they had to pay out in coverage each year or over a lifetime. Before the ACA, while not all health coverage was capped, most companies had some sort of limit in place. In 2009, would face lifetime limits on their coverage without the health law, with some companies saying they would cover no more than $1 million in medical bills per employee. The vast majority, 60 million Medicare beneficiaries, would face changes to medical care and possibly higher premiums. About 60 million people are covered under Medicare, the federal insurance program that covers people over 65 years old and people with disabilities. Even though the main Medicare beneficiaries would have to pay more for preventive care, like a wellness visit or diabetes check, which are now free. They would also have to. The law also made other changes, like cutting the amount the federal government paid hospitals and other providers as well as private Medicare Advantage plans. Undoing the cuts, the ACA was also responsible for promoting experiments into new ways of paying hospitals and doctors, creating vehicles like accountable care organizations to help hospitals, doctors, and others to better coordinate patients' care. If the groups save Medicare money on the care they provide, they get to keep some of those savings. About 2 million young adults with coverage through their parents' plans. The ACA required employers to cover their employees' children under the age of 26, and it is roughly 2 million young adults are covered under a parent's insurance plan. According to if the law were struck down, employers would have to decide if they would continue to offer the coverage. Dorian Smith, $50 billion medical care for the uninsured could cost billions more dollars. Doctors and hospitals could lose a crucial source of revenue, as some people lose insurance. The Urban Institute, hospitals and other medical providers would incur losses, as many now have higher revenues and reduced costs for uncompensated care in states that expanded Medicaid. By the Commonwealth, the health insurance industry would be upended by the elimination of ACA requirements. Insurers in many 1,000 calories menu labels are among dozens of the law's provisions that are less well known. The ACA requires nutrition labeling and calorie counts on menu items at chain restaurants. It requires many employers to provide reasonable break time and a private space for nursing mothers to pump breast milk. It created a pathway for federal approval of biosimilars, which are near copies of biologic drugs, made from living cells.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.